Quality standards for facility management. Here we will learn about the different areas of facility management and different security programs related to the facilities in a hospital, physical facilities in a hospital. So, facility management and safety. Healthcare organizations work to provide safe and functional and supportive facilities for patients, families, staff, and the visitors. So, your physical facility of a hospital should be safe for the patients, their visitors, families, and staff. Space management, catering, safety protocols, database, attendance, scheduling, asset management, maintenance management are all the different areas of the facility management services. Management must strive to reduce and control the hazards and their risk. As much as possible, make your facility strong enough that the hazards and the risk are reduced. Prevent the accidents and injuries as much as possible and wherever possible. Maintain safe working conditions for your staff. So areas of facility management systems are safety, the degree to which the organization's buildings, construction areas, grounds, equipment do not pose a hazard risk to the patient, staff, and visitors. Then security, protection from the loss, destruction, tampering, or unauthorized access to or access or use of any data or any physical facilities. Hazardous materials, handling, storage, and use of radioactive and other materials controlled and hazardous waste is safely disposed. Emergency management, risks are identified in response to the epidemics, the disasters, etc., which your region is prone to. Accordingly, you will plan an emergency management beforehand. And mock drills of such emergency management should be played out. Fire safety, conducting ongoing assessment and of risk and enhanced protection of the property from fire-related hazards. Medical equipment selected, maintained and used in a manner that reduces the transmission of infection. Utility systems, electrical, water supply, power, telecommunication, other utility systems are maintained to minimize the risk of any operating failures. So FMS programs, mainly they are safety and security program, hazardous materials program, for example, the biomedical waste management, emergency management program, disaster management programs, etc., and fire safety programs. These are the 4 main programs coming under the facility management services. Hazardous material program. This program is in places that include identifying and safely controlling hazardous material and waste throughout the facility. For example, nuclear medicine may have hazardous material like radioactive isotopes. Laboratory may have hazardous acids and corrosive objects. So hazardous material program will apply there. Manifold will have access to inflammable gas, etc. So WHO identifies hazardous materials and the waste by the following category: infectious waste that can make sick the other susceptible host, pathological and anatomical items, pharmaceutical items, radioactive items, chemical items, heavy metals, pressurized containers, and sharps. These are the items that are identified by WHO as hazardous material. Hazardous material and waste program includes inventory if the hazardous inventory for the hazardous material and the waste should be kept proper and regular inventory audit should be done. Handling and storage and the use of hazardous material should be recorded as and when it is used and who is handling it and who is responsible for using, storing, and handling the hazardous material. Proper personal protective equipments and procedures should be done before handling hazardous material. Reporting and investigating any spills, exposure, or any other incident. Proper disposal of the hazardous material, especially if it is radioactive, how it should be disposed, etc., should be followed under the given local and the national law authorities. Documentation of permits, license, etc., should be kept so that only licensed institute can get the permission to make use of hazardous material within the hospital. Disaster management program. So community emergency and disaster may directly involve hospitals. So identify the types of the disaster that are likely to occur in the hospital region and its impact on the hospital. Check where physically your hospital is present when it comes to the regions which are prone to disasters, which kind of disaster is your region prone to in general. Identify that and locate where is your hospital situated in a disaster prone area. If yes, accordingly you have to be prepared. So determining the impact of disaster, the effect the disaster will have on the structure of the patient care environment. Will it physically damage your hospital building? How the building will respond? Will the building shatter down or can it withstand the disaster? Evacuation plan. If at all the disaster strikes, do you have an evacuation plan at your hand? Are your employees trained with the evacuation plan? And identify the priority area. Mostly the high risk area will be the first priority area if the disaster takes place. Disaster management program provides processes for determining the type, likelihood, and consequences of hazard. It depends upon region to region. Determining the structure integrity and their performance, how strong the physical structure of the hospital building is, and how it can withstand the disaster. Determining the hospital's role, how it will evacuate its inhabitants. Determine the communication strategies. Do you have emergency communication walkie-talkies at your disposal? If at all the communication lines go away when a disaster strikes. Managing the resources, properly allocating the resources according to the priority, especially the food, water, and other medical resources. Managing clinical activities, how to continue the clinical activities even during the disaster has struck. Identify and assign staff role. Each staff should be assigned a particular task when it comes to an evacuation plan and disaster management mock drills. Disaster preparedness program is tested by annual test of a full program internally or as a part of a community-wide test is conducted. Usually the quality team will be in charge of this and the emergency department with the help of emergency department. Testing of critical elements of the program during the year. Mock drills can be conducted internally at any point of that time. Fire safety program. So for prevention and early detection, suppression, abatement, and safe exit from the facility in response to fire and non-fire emergency. So that is the task of fire safety program. Regularly test its fire and smoke safety program, including the devices, the sprinklers, smoke detector, everything. Regularly check if it is out of factory or not, if it is working or not. If repair needs to be done, it has to be done. Assessment and assessment of risk include the following. Pressure relationships in operating rooms. You have to check that if an operation is going on and if a fire strikes, how you are going to protect the patient on table. Fire separation, smoke separation, hazardous area, fire exits, kitchen grease production, cooking area, and laundry and trash chutes, emergency power system equipment, medical vacuum system components, etc. These are the areas which possess the high risk of catching fire. So regular assessment of these areas should be done. Reduction of fire risk. Fire safety program should be implemented everywhere and limit the smoking by staff patient to a designated non-patient care area of the facility. If you have smokers among your patients and the staff, a smoking room which is away from the non-patient care area should be provided by the facility. It applies to all. Designated non-patient care areas for smoking should be ventilated to the outside and not the inside. Functional fire extinguishers and fire hose is suitable at the suitable locations should be provided. And the staff should be trained in case of emergency how to break the glass and use the fire hose and how to shut down the fire. Such training should be given to the staff. 4 steps to use a fire extinguisher. First, you have to remove the safety clip, aim at the base of the fire, squeeze the safety clip, and then in a sweeping motion, spread the fire extinguisher. This is how the pass technique follows. Pull the safety pin, aim at the base of the fire, squeeze the handle, and sweep from side to side. This is how you use a fire extinguisher. Quality standards for medical equipment. The hospital establishes and implements program for inspecting and testing and maintaining medical equipment and documenting the results, because medical equipments are directly in contact with the patient care areas and they are used for patient care. So it has high risk of transmitting infections if not cared properly for. Documentation will be, and there should be an inventory of a medical equipment to check if there is any theft or misuse or forgot the medical equipment in any of the operating site, etc. Regular inspection of the medical equipment should be done for rust, any damage, etc. Testing of the medical equipment according to its use and manufacturer's requirements. Performance of preventive maintenance should be carried out on regular basis. Inspect and test new equipments before you put it into use. Qualified and trained staff are put to handle the equipment. Do not give new equipment or hospital equipment in the hands of an untrained staff. It may cost some valuable resources to the hospital. Monitoring and acting on the device notices. Before any device notices comes up before warranty, do the repair as and when scheduled. Report the deaths and illnesses related to the medical equipment, and CAPA action, corrective and preventive action, should be taken care of. Utility systems management. The things you have to remember here is 24/7, 7 days a week, the hospital should have potable water. 24/7 of 24 hours, 7 days a week, electric power should be there. There should be no disruption in the power. Areas at great risk when power fails or water fails, you have to identify which areas will be at great risk, and a second-hand substitute should be provided. Plan alternative sources of both power and potable water as and when required. Document the results of water test from all the purifier and all the sources of water at least once a month. Send the culture swabs and tests should be reported. Quarterly test alternative sources of power and water, and document the result. If you have alternative sources of power and water, quarterly test is enough. Monthly test is not necessary. On-site fuel is stored if at all there is a power cut. Designated individuals are given are allotted particular water areas and power areas for monitoring. Quality of non-potable water is tested in every 6 months. The water which you use for cleaning, bathing, scrubbing, etc. Water used for renal dialysis is tested monthly for bacterial growth and endotoxin, and tested annually for chemical contaminants. Implement measures to prevent contamination as and where possible. Monitor the effectiveness of the measures implemented. If the measures taken is not leading to the expectations, you have to change your measures. Take actions when water quality is found to be unsafe. Water supply and wastewater. So the water quantity is the key element of infection control within the healthcare facilities, and particular care is ensured that that immunocompromised patients have access to safe drinking water, given their high susceptibility to infection, etc. So that is the important role of water quality here. And water presents no risk. You have to ensure that your water is good for health. It has no risk. It is protected from contamination. Ground level of water from a treated supply kept safe until use. Okay, from wherever groundwater is being sourced, it should be locked. It should be kept safe until it is used. Boiling, filtering, and chlorinate and disinfect the untreated water from unprotected sources without fail. Non-potable water should be used only for cleaning, laundry, and sanitation. It should not be used for drinking purposes or any ingestion purposes. Water quantity. Wastewater disposal should be done into the sewers after proper treatment, should be removed rapidly, and cleaning from the point of production where the waste product water is produced. It should not be stored. It should be removed rapidly. Drainage system should avoid contamination. Proper functional sewer system should be in place. If at all sewer system is not functional, inform the municipal authorities, and proper care should be taken to rectify the changes. cover the open wastewater drainage system so that vector-borne diseases will be prevented. Small quantities of infectious liquids may be poured into the sinks and toilet, but not large quantities. Toxic waste should be treated as healthcare waste, and then only it should be disposed into the water bodies. Power. The light should be should provide a good ambience. Ambient light for daytime tasks should be available. The sources of the power will maybe like solar panels, generator, some vehicle battery in case of emergency, etc. The main electricity supply should be locked and should be away from the reach of the visitors, etc. It should be in a scheduled area, secluded area. Solar panels are used. Using vehicle battery, if at all, is an option when second battery can be installed. Temperature control in the pharmacy room area. First, use the methods that do not require power. Add ceiling and air vents, windows and doors as much as possible. Wherever you can reduce the use of temperature dependent control, try that. Then add a fan, and the final option should be the air conditioners. Communication infrastructure. It is essential that the clinical team has a physical means to communicate with each other and to consult on side effects, other complications, etc. So center must have a reliable distance communication between it and with the district-based medical officers, etc. So ways to improve that distance communication. The first one is telephone. Mobile telephone networks are everywhere now. It's an alternative to landlines, which do not exist as of now, but within the hospital, landlines will exist for interdepartmental communication, etc. And then we have citizens band radio. It's a cheap and effective methods of communication. You have runners sending messages with truckers or mail boys, etc. Others regularly who are driving through the source and their destination. Email is feasible in some settings, but in India, not all the hospitals have access to internet. So that is one drawback in email. Washrooms. There are some basic requirements in washroom. There should be one washroom for 4 staff, 2 washroom for 2 or 4 staff when there is male and female. But if they are of the same gender, one bathroom is enough for 4 staff. And the design of the washroom should respond to the local culture and social condition. For example, when it comes to the use of Indian commode and Western commode, there is a cultural aspect there. And easy to use toilets for physically handicapped, heavily pregnant women and elderly sick women. There will be railings within the toilet to support if they are prone to any falls. Children's toilet, the size of the drop hole should be adequate for the child, not too large, etc. That has to be taken care of. In toilets, the signpost to the toilets and latrine should be clearly visible to help the users to find the toilets. Water points with soap and drainage should be there within the toilets. It should be hygienic and it should be acceptable to use. Regular scheduling of the cleaning should be done. Control measures against mosquito breeding should be followed. Regular cleaning schedule should be done by the housekeeping staff. Minimize the risk of violence. Toilets are the areas prone to many physical assaults and sexual assaults, so that care has to be taken care of. Locks for users should be provided, but locks for users from inside should not be provided when it is an inpatient ward. Only from outside the lock should be provided for public use. Public use, outside and inside locks can be provided, but for inpatient use, only outside locks should be provided, not inside. 90% of the microorganisms are present within the visible dirt. So whenever you see a visible dirt, it has to be cleaned out. Thank you.